name is Zainab Naseer. I graduated from medical school in June, and I just finished this rotation with Dr. Sami, Dr. Linder a week ago. Like Julian said, it was a great experience to learn about radiology and how to see images, even though I still struggle with it, but it is so much better than before. So today I will be presenting on radiology of hepatobiliary diseases. So my objective would be to review the anatomy of hepatobiliary system on a plain radiograph and different radiology films, discuss the specific of different radiology exams, the algorithm and the clinical hepatobiliary diseases, and correlate the images with differential diagnosis. Sorry, it's a little cut off, but this is a plain radiofilm of the abdomen. You'll see the hepatic angle, the splenic angle, the renal shadow, the psoas muscles, and properitoneal space. This is just to show the plain film. Okay, so you have the gallbladder anatomy here, where you'll see the normal gallbladder, and this is in a fasting patient. So just to go back to the anatomy of the gallbladder, it's embryologically deviated or foregut, and you can see it's like a pear-shaped muscular membrane sac, and it lies inferior surface of the liver and serve to store your bile, and which is produced by the liver. It have capacity of about 50 milliliter and a measure 8 centimeter in length and 4 centimeter in diameter when distended. The gallbladder normally receive its blood supply from the cystic artery, a branch of the right hepatic artery. And on imaging, this is a normal gallbladder, which is a pear shape. So I just came up with a patient presentation in leading into my diagnosis. So if you have a patient that is presenting with right upper quadrant pain, have a yellow discoloration of sclera, which we also known as jaundice, you'll have pale stool and a complaint of dark urine. You'll think of gallbladder stones, which you can see over here. It is radio opaque. You'll see the laminated appearance, the dense rim behind, around the radiolucent stones. The stones can be visualized in different radiological examination, like ultrasound, MRI, also done MR, CP. You'll see which shows the it helps visualize your gallbladder, and you're able to pick up the stones on that. The most common disease that we talk about when it comes to gallbladder stone is acute cholecystitis. And as you can see on the image, it will show you the gallbladder thickening the wall, which is more than 3 millimeter. You'll see the distended gallbladder surrounding the fluid around it. You'll see the stone. And if you visualize a gallbladder without any stones and stuff, but they still have the same presentation as the one as I mentioned before, then it would be acalculous cholecystitis, because they do not have the calcium stones or any pigmented stones or any other stones. Another image modality that we use is ultrasound to visualize gallbladder stone. So as you can see, I have a normal and abnormal images of the ultrasound. So in this, you'll see the dilated bile duct, usually causing the obstruction, caused by the obstruction of the biliary tree. It's due to the stones being lodged in the common bile duct. It could also be due to other reasons, like having a mass, and you'll see this image where it would pick up the color and the contrast. You could also use a CT scan, as I mentioned before, to diagnose acute cholecystitis. On a CT scan, you'll see the thickened, enhancing shadow around the gallbladder. You'll also see the pericholecystic fats, which is pointed with the white arrow. And then you'll see the hyper enema around the liver, which is showing over here with the black arrow. You'll see the large stone at the neck of the gallbladder right here in 2B. And that would be how you're able to pick up acute cholecystitis on a CT scan. This is again an image of an ultrasound showing the normal well, this both are not normal. This is still with the stone, but one is with the inflammation, one is without. So over here, you'll see with the inflammation, which is more darker presenting, whereas over here, you'll see without the inflammation. You can also pick the same disease up by using MRI. In this case, you'll see multiple stones large in the gallbladder and in the common bile duct. Another images that are very popular and we also use is HIDA scan. And HIDA scan is used to diagnose different diseases. So the way HIDA scan is done is when the patient is given IV contracts, IV injection of Syncalide, which makes your gallbladder contrast and empty. You're also given other drugs like morphine at times to make your gallbladder visualize more, and the gamma camera is able to position over your abdomen to take pictures of the tracer as it moves through the gallbladder, and it'll pick up the scan. It will pick up the stones as you can visualize it here. Other diseases, like I mentioned, you can use HIDA scan for is biliary atresia. You can use it for bile injuries, post-surgery. For example, if a person had a surgery for abdomen and if they had any lesion or any injury to the bile duct, they are able to visualize it with the HIDA scan as well, or bile obstruction. Another thing that we use all these images to pick up is calcifications, and they are seen in many different diseases. As I mentioned, one which was gallstone. You can also see in porcelain gallbladder, kidney stones, and pancreatic calcification. I will go through them as we move forward. So here is an image of a porcelain gallbladder right here, which is circled in red. It is, so when I mention calcification, I'm basically talking about calcium deposits. So you'll have extensive calcium leading to calcification in the wall of the gallbladder. Most of them are associated with the stones that are found in the gallbladder. It also is indicative of chronic obstruction of cystic duct and chronic inflammation. You can also see calcification in kidney stones throughout the process of learning of nephrology. We know that there are many different stones. You have urea stone, you have different bacteria that can cause kidney stones. Calcium is one of the most common urinary stones that we do talk about. Over here, you can visualize the horn stones. They look like the horns. They are occupying the collecting ducts bilaterally in a kidney, which will affect the urinary system and the collecting system of the kidney. Over here, you could see pancreatic calcification. It is very visualized, as I have pointed out with the arrow. Pancreatic calcification are also indicative of chronic pancreatitis. Calcification is punctuated as you can see over here. Of course, it may have a focal segment or diffuse distribution. It can expand upward and across the left upper quadrant, as you can see over here. Pancreatic calcification due to pancreatitis could be due to many reasons, commonly seen in alcoholic patients who have pancreatitis, chronic pancreatitis. Also to compare with liver disease, so I have image next to each other. This is your normal liver, and then over here you can see the nodality in the liver image, and I would go through it as I move forward. So you see in liver cirrhosis, the nodality in here, you'll see the shrunken size of your liver, you'll see the hyperaechoic parenchyma, you'll see ascites. This is also seen a lot in alcoholic patients. You'll see the hypertrophy of the caudate lobe, the left lobe, with shrinkage of the right lobe. You'll see extrahepatic sign, which is like evidence of your portal hypertension, splenomegaly, and ascites, the nodality of the liver, which is the most pathognomonic of liver cirrhosis in itself, You could also see and pick up liver cirrhosis by using CT scan, and you can see over here, or MRI scan would also work for that. Those are different modalities to see liver cirrhosis and also to pick up the complications of liver cirrhosis, which is portal hypertension and hepatocellular carcinoma, which is the most common type of cancer that a patient could develop having cirrhosis. Differential diagnosis of liver cirrhosis would be benign or malignant. So in benign, you'll have hemangioma, adenoma, focal nodule hyperplasia. In malignant, you'll have hepatocellular carcinoma and metastasis. And the way to differentiate between benign and malignant is to do IV contrast images to be able to pick up between benign and malignant. This was my quick presentation on just comparing different diseases. Does anyone have any feedback, any questions?
Very well done.